Okay, so we just heard for PCOS, lower carbs, high fat. I mean, that sounds easy enough, but we have
Right.
carnivore, we have keto, we have Atkins, all of those. I mean, what's a woman to do, Dr. Fox?
It's a tough world out
Yeah.
there in the nutrition world. It really is. So, again, the goal is to get insulin down. The only way to really get insulin from in patients who have insulin resistance, the only way to get that insulin down is to get total carbohydrates somewhere in the under 20 grams total carbs a day. Some, depending on the severity of disease, maybe it's 25 grams. Everybody's going to be a little different, but that's going to bring the insulin down. So if we subtract out all those calories from carbohydrates, then we have to replace it with something. So the three macronutrients are carbohydrate, fat, and protein. So what we want to trade is with fat, not really with protein. Most Americans are getting the appropriate amount of fat in their diet and don't really need to increase protein. Unfortunately, and it's kind of a truism in the nutrition world, that when a diet gets a catchy name, everybody goes for it. For example, when we started in 2001 with low carb, high fat, that's kind of a dull name and nobody was really interested. When it picked up the keto name, then it was there was big interest and a lot of people were really involved in it. Keto's starting to fade, and now carnivore has come to the forefront, and the idea of just high protein. The problem with high protein is protein in excess gets converted to blood sugar that then stimulates insulin release, so we still get that really high bump in insulin. And we're talking about insulin increase, but we're talking about massive insulin increase. So whereas the level should be around 20 for most people, we see levels of 100, 200, 300, 400, just massive amounts of insulin, which create not only weight gain and PCOS, but all kinds of health problems such as cholesterol, diabetes, heart disease, high blood pressure, stroke, fatty liver. I mean, we could just go on and on.